going to hear from a mom in a little bit who actually was on the service. It's really simple to sign up. You can do it right now. You can do it during the break. You simply text the word baby or baby, if you prefer Spanish language, to 511411. That's it. And we'll ask you for two simple pieces of information. One is, what day is your baby due? Or if your baby was born, because we go through the first year of life, what's the baby's birthday? That's critical because what's really unique about the text4baby program is it's stage-based. So the 3 SMS messages that a mom or an expectant mom receives every week correlate exactly to what's going on with her body and her baby that week. It helps people get into prenatal care if they're not already in. That's one of the biggest reasons we have low birth weight and prematurity. We've got to get people into the care pathway, but it also sends out incredibly important and timely health information that is really developed to change behaviors, to healthy behaviors, to give moms critical information that they can talk to their doctor about at the right time, and also to connect moms with critical services they may not have access to. How do you connect to WIC? How do you get a flu shot if you want one? Those kinds of things. Lots of hotlines and that sort of thing. The other piece of information that we'll ask for is your zip code. Really simple. So no email, no name, nothing identifiable, but the zip code is really important because it helps text4baby understand where its moms are. And this has become increasingly important as our government, the CDC, which is one of the partners of text4baby, asks us to get out very timely alerts. So as an example, and I want to read for you a message that I got just yesterday. If I can find it here. Free message. That's the other thing. The message, and we'll get to that, but the messages are always free to the incoming mom. You can hear a little bit more from the wireless industry a little bit, but it's their support in waiving the fees for moms that makes this program work. So it's a free message. Babies can get sick or die from whooping cough. Parents, siblings, and grandparents can help protect baby by getting a Tdap shot before baby's born. So you see how simple a message is. It's just an SMS word. It's very easy to understand. Now let's get back to the zip codes. I actually work in New Jersey. And New Jersey is one of 9 states that has been in the throes of a really significant outbreak, pertussis outbreak. So what happened is the CDC said, can you please get a message out, right, to people? Well, because we have their zip codes, we know exactly who to send the message to. So really critical that we get the zip code information. I want to really close with mentioning the partnership, because that's what makes it work. When we think about even the philanthropy that we're involved with all around the world, our approach and the way it works best is to have partners that are on the ground. You've got to work with people that know the local community best. That's how things work. So when we look at this really unique partnership that text4baby has really grown into in 2.5 years, it's that idea on steroids, sort of. So we came in as founding sponsor. CTIA, which is the Wireless Foundation, and a number of carriers that they represent came in at the beginning. And that was the beginning of a broad partnership. We've got many government agencies from the White House Office of Science and Technology, CDC, HHS. So you can imagine the kind of clinical content we have. We then needed to get the major medicals involved, the AAP and the ACOG, groups I know people in this room are familiar with. And that was only the beginning, because again, things have to happen on the ground. So it's the 800+ partners that are out there in the community, state health departments, networks such as the Infant Mortality Network here in Tarrant County, local health departments, clinics, and so on, that are actually every single day connecting expectant and new moms with text4baby. While we know text4baby on its own cannot cure prematurity, cannot decrease infant mortality, it can be an important piece of it, and importantly, getting moms connected. What I'll close with is something that's been really important to us at J&J, which is, does it work, right? We got involved with it in the beginning, said, let's see how it goes. Makes everyone feel good. Feels like the right thing to do. Certainly can't do any harm, but is it going to work? Is it going to really change behavior? And because text4baby is the largest mobile health information program of its kind in the world, and really the model of which not just other perinatal type programs are coming online, but around other disease states and so on, smoking cessation, type 2 diabetes management, and on, we felt it was really important to make sure this actually is resulting in behavior change and a good outcome. The great news is 2 outcome studies in, significant changes. And moms, that have been in the study, talking to doctors, their doctor, about things they read in a message, learning about some important safety tip they didn't know, actually changing their minds from, I think a flu shot can harm me or my baby, to, I get why I need one, and if I can't afford one, I now can get connected to the zip code service to a clinic to provide me with a flu vaccine. So early days still, 2.5 years in. The great news is text4baby works, and our biggest challenge is how do we reach more and more moms? Free service. We really want to reach a lot of moms, so it's terrific to have this opportunity to share this with you today. I'll close with, this is about baby's first birthday. We want to help every single baby reach their first birthday. And speaking of birthdays, we want to be the first to wish Mr. Steve Largent happy birthday tomorrow here in Texas with us. And with that, I'm going to introduce Steve, who is the president and CEO of TIA, the Wireless Foundation.
It's hard to believe I turn 29 tomorrow. Well, thank you, Susan, for those remarks. And I just want to say, first of all, I get asked about this all the time, especially this week, that Golden Tate absolutely caught that pass for a touchdown in the end zone. There's no question about it. Those of you who probably don't know, I played football in the National Football League for 14 years for my home team, Seattle Seahawks. And so I always have a bit of a slant on that game on Monday. But I'm really pleased to be here today, and I want to thank the Infant Mortality Network and Texas Partners for hosting this important conference. I'm glad to see so many of you here. text4baby is proving to be an enormous help to hundreds of thousands of new and expectant mothers all over the country, and our goal is to reach many, many more. One of the unique aspects of text4baby is the use of widely adopted technology to address an unfortunate public health problem. You're going to hear a lot today about the issue of infant mortality. It is a public health crisis in this country. The U.S. has one of the highest infant mortality rates among industrialized countries. When you think about the outstanding quality of health care we have available, I find that shocking. There are a lot of possible solutions to that problem, and one of them is better education. That's where this little device comes in handy. You can have such a great impact through using this device. More than 80% of women in the U.S. have a cell phone, and about 3/4 of all adults with a cell phone send and receive text messages. So it's a technology that's easily adopted and has been already. That adds up to a great opportunity. text4baby combines the power of wireless communication and the innovative public-private partnership. We're providing important, fundamental, and relevant health information to expecting and new moms, as you just heard. It's making them more aware of things they can do and should be looking for to ensure their babies get a healthy start in life. I can't think of a better use of wireless technology, really. And I'm proud of how the industry has stepped up to be part of this partnership. Wireless service providers are playing a critical role by offering these text messages at no charge. And they've done that for, I think, 2 years now. 3 times a week, mothers and mothers-to-be are receiving text messages with essential health information you just heard. They're learning about things such as early and adequate prenatal care, immunizations, safe sleep, preventing birth defects, avoiding substance abuse, and many other critical health and safety issues. Thanks to the support of the wireless service providers and more than 825 national, state, and local partners, more than 400,000 individuals have enrolled to receive these simple and effective health tips. That makes text4baby the largest mobile health initiative in the country today. ZTIA and the wireless industry congratulate the leadership partners in Texas on the critical issue of maternal and child health. Your continued commitment is crucial to getting our nation's babies off to a healthy start and to the success of text4baby service. We sincerely appreciate your promoting text4baby to the women that you reach. Thank you for all that you are doing and for including the wireless industry in today's event. I mentioned earlier that service providers are helping the cause by making the messages free to the end user. AT&T is one of them. Adam Vital is a vice president in North Texas for AT&T Mobility, and it's my sincere pleasure to welcome him to today's conference. Adam?
Steve, thank you for the introduction, and happy birthday in advance. Good morning, everyone. AT&T is happy to support moms in our communities by providing text messages for free through the text4baby service. Approximately 1.4 trillion text messages were sent and received in 2009 in the United States. And this popular means of communication is particularly favored among women of childbearing age and minority populations. Here at AT&T, we recognize the opportunity exists to deliver vital health information by text messages to those who need and want those messages the most. One of the most powerful things for us is the testimony we have heard from moms who benefited from the text4baby service. One of our customers, Jenna, recently shared this feedback on her experiences. I love the text4baby keeps me updated every week about what my son should be doing at his age, how to reach someone if I need to talk about any issues, and things I should be looking for, such as an illness, or if my son is not up to date with what he should be doing. I love knowing that my son is always doing the things at the age he should be. Hearing Jenna's story reminds us all of why we're here today, and why AT&T is so proud to be a part of this initiative. Thanks so much for including us, and we look forward to continuing to support moms, babies, and families in Texas and around the country through text4baby. Thank you.
Thank you so much for your comments. And I will say that I know that Seattle made an impact on your life, but they must have made an impact on the NFL too, because I heard they're going to decide about their officials now, right? Well, in my haste earlier, I forgot a couple of housekeeping things, and even though we're talking about texting, please put your phones on silent. We want to do that. And we have lots of people who are lining the walls because we don't have enough seats. And I think it might be because they're occupied by purses and bags. And so if you have a seat beside you, raise your hand so we can give everybody they can take a load off. Okay, y'all, come on down. Also, we have great food that's offered to us today, and that's wonderful. But we do need to kind of police our areas when we leave to make sure that we take all of our leftovers back outside. That makes it a whole lot easier and puts a smile on the face of the people who put things together for us today. Now, back to what we came here for. I just wanted to get those things out of the way and get people a seat. I'm honored to introduce a coworker of mine from Tarrant County Public Health. Candace Smallwood is a community health worker. She works with the WIC program. She's also a relatively new mom for the third time around, and she has been a text4baby consumer. So Candace, you want to come up and tell us a little bit about what your experience was?
Thank you, Ann. Like she said, my name is Candace Smallwood, and I work for Tarrant County WIC. I'm a community health worker, and I became pregnant for the third time. So I'm accustomed to referring text4baby to my clients. So I decided to sign up to see what I was referring. I text baby to 511-411. It was very, very easy. I texted the delivery date, and what I thought was unique about this program is that you can text anytime before the first birthday. So you can text during your pregnancy, and even after you have the baby, you can still text to 511-411. They provided reminders for me, even though I'm an expert in the baby business. The texts were very informative. And I look very forward to receiving the text messages. I remember receiving text messages about my baby's brain development, information on breastfeeding. They also text information on getting vaccines and flu shots. I called the hotline because they text a referral saying that if you need a referral to WIC, or if you need a referral to Medicaid, or to receive SNAPs, I need you to call this number and they can help you out. So I wanted to see, how was it? So I called the hotline. It didn't take me very long to even navigate through the process, so you don't get very discouraged. The doctors text message you, like if you need a doctor, just anything you need. It was very informative. Now that I've experienced this free service, I definitely recommend it to my mom and to any of my clients and my friends. And I really, really look forward to receiving my text messages. They send like 1 to 2 text messages a week. So I was very, very excited about it. And the text messages were right on target. So they were like, make sure you watch the baby. They might start rolling. And I got really excited because the next day my baby started rolling. You know. So thank you so much for making it easy for busy moms like me through this easy process and this wonderful service. Thank you.
Thank you, Candace. One day we were having a conversation and she was telling about her daughter who's in the Texas Girls Choir and another child that's busy with things, and then with a new baby, she said that the text helped keep her on track about some things because she had so many different plates she had to keep spinning. So it's been a big help, and thank you, Candace. Well, now I'd like to welcome Congressman Michael Burgess. He has a really long bio, but what I want to do is just introduce him as one of the best friends to the Tarrant County Infant Mortality Network.
Thank you. You're very kind. Was this thing working? Okay, that's it is. All right, great. I have to be careful what I say. I'm really excited to learn about the technology, and that's what I like about coming to this event because I learn stuff every time I come. And I was not aware of what you were doing. It's a phenomenally good idea. When I first heard about it, it kind of took me back decades ago to Parkland Hospital, and Jack Pritchard was in charge of our obstetric program there. He's got a crusty old character, but he had developed the community clinic concept, and he did it with such a low-tech device that you almost think you just marvel at how he would come up with this idea. He had a map of Dallas County. He put a pin in the map every time there was an out-of-hospital birth. And by doing that for a year or so, he knew where to locate the clinics because this was the area where utilization might be an issue. Now, you're marrying some low-tech stuff from years ago with the high-tech stuff of the smartphone. And it's a phenomenally good idea. There's a doctor, Atul Gawande, who writes a lot about medical issues. Sometimes I agree with him, sometimes I don't. He wrote a lot about checklists and how checklists can help doctors in the operating room. I knew this because in the early 1980s, I got a pilot's license. And as part of learning how to fly, you do checklists, so you don't forget important stuff, like you say, gas the plane, things like that. Well, a checklist seemed like a good idea in my practice of obstetrics. So when I revised my prenatal chart for our group, I kind of incorporated the checklist concept. So that if a patient came in and her doctor was tied up with something else, so she saw one of the partners, at 28 weeks, no one would miss the fact that she was Rh negative and needed a Rogaine injection. At 18 weeks, no one would miss the fact that here she is well into her second trimester and no one had done a glucose screen. So that we were less likely to overlook those things and become part of our routine. And I'll just tell you, for someone who practiced obstetrics for 25 years, the patient will always try to distract you with stuff. You know what you need to do at 28 weeks, but the mom always comes in with questions, usually supplied by her mom or her sister, but then they'll live with things that have to be answered. He keeps you on track, so a checklist is a useful thing. So now we're putting the power of the checklist into the hands of the patient, and that is powerful. We all talk about personalized medicine and how we want to empower the individual. This is where the rubber meets the road. So we can use the knowledge that our great Tarrant County Health Department has developed about, yeah, we've got a problem in Tarrant County, and we know some of the zip codes where we really have a problem. These are the areas where we might want to concentrate that cell phone text4baby use, particularly in the prenatal period, but also in the postnatal period when many of these unfortunate incidents occur. It's a very powerful marriage of technology and empowering patients. I'm happy to be you've got some data and you've got, you know, in order for something to make a difference, it has to make a difference. And apparently, as it turns out now, you're making a difference, and that's what counts. Thank you for letting me be part of your board this morning. I look forward to some of the rest of the discussion later on. Thank you.
For some of you who may be new to the summit, and Susan referred to this month, September is Infant Mortality Awareness Month. That actually had its roots here in Tarrant County. Congressman Burgess sponsored that legislation, and it's really cool to travel around the country now and hear people talk about the activities they're doing during Infant Mortality Awareness Month. Because we could say, oh yeah, we know about that, we were a part of that. So we really appreciate your support. It's time now to shift to our legislative portion of the program, and we're going to get as much out of Congressman Burgess as we can because we're having him stick around a little bit longer. And so, Congressman Burgess, if you'll join us at the table here. We also have Senator Wendy Davis. We have Representative Mark Shelton and Representative Mark Beasley. And everybody will be happy to see you.